Well, hello, doctor. This is Rick Orchard. Thank you for joining us today. We're going to make this as quick as possible because we realize you're very busy. Today, we're going to give an overview of Medicare's chronic care management program. In 35 years, this is the best ancillary program I've ever seen. Can you believe it that Medicare actually wants to send you new revenue? So here's a quick background. CMS created this program back in 2015, but started marketing it this year in 2016. They've earmarked $19 billion for this program. They're very serious about this. This is their baby, in my words. They created this program obviously to save themselves money, but their main goal is twofold. One is to reduce the number of visits in the emergency room or ED department and hospital stays. And they want to move from fragmented care to coordinated care. That was one of their objectives that they wanted to accomplish with Obamacare, which did not happen. And now that's going to be, in theory, repealed and replaced. So their concern is seniors, as you all know, seeing their primary care physician, but they typically see, 2 or 3 other specialists at the same time. As a general statement, Dr. Jones does not speak with Dr. Smith on coordinating care for that patient, and that's one of the main objectives of this program, is to manage all their chronic conditions at one place. So here's an overview. For the patients to be eligible, they need to have 2 or more chronic conditions. Most seniors, almost 90%, will comply. Most of them have more than 2 chronic conditions. The benefit to the patient is they're going to have more comprehensive patient-centered care. Again, we're going to have an MA talk to the patient at home at least minimum once a week to review their chronic conditions. Are they taking their medications, to remind them that they have a doctor's appointment tomorrow or whatever. It's patient-centered care, which is a wonderful benefit to these seniors. One of the advantages to the practice, this unintended consequence, but a wonderful consequence, is the patients don't call the practice anymore for their questions. As you know, there's no CPT code to answer an annoying question from a patient. And now they're going to have a human being talk to them at least once a week about their health, which is a wonderful benefit to the patient. In exchange, Medicare wants to send you additional revenue. They pay around $500 per year per patient. They actually pay it monthly, and it ranges on your geography between $38 and $52, but on average, it's about $40 a month. But there's a catch. They'll only pay one physician to enroll the patient into the CCM program. So the first doctor wins. So there's a natural incentive for you to hurry up and enroll your patient so that another doctor does not do so. Now, who's eligible? By the regulations, it specifically mentions that dentists, podiatrists, psychologists are not eligible. And who should not participate in the program? Really, physicians who discharge patients, surgeons, and then dermatologists, ophthalmologists, psychiatrists, doctors who typically don't deal with chronic conditions. But your primary care physicians, specialists, pain doctors are prime candidates for this program. All right, so that's the good news. But with every good news, there's always bad news. There's over 19 pages of over 40 regulations for this program. It's impossible for a doctor's office to comply with the regulations. For example, I'm just going to mention 3. The regulations state that the doctor must have 20 minutes of non-face-to-face time with the patient each month. Well, if you did that, you couldn't do anything else. You'd spend your entire time talking to your senior patients on the phone for 20 minutes a month. Another regulation says that you need to provide 24/7 access to live access to a care member. on your team. There isn't a doctor in the office in the country that provides a nurse 24/7 live, not a recording, not a phone answering service, live to talk to a patient. Another requirement is you have to be online with every EMR system in every hospital in the country. So Medicare realized that that was impossible for a doctor to comply. Therefore, for the first time ever, CMS gave an exception to the direct supervision rule for the first time ever, which makes it possible for you to hire a third party to provide this solution to your patients on your behalf. So we usually are asked 3 questions regarding any ancillary, really. What does it cost me? How much time is this going to take for me and or my staff? And what's the benefit? How much money am I going to make? So we're going to answer those 3 questions. We vetted out the top tier vendors in the country, and Oculus Health is the most sophisticated compliance company in the country. Several large health systems came to the same conclusion, and they're the only ones that has a written guarantee for a compliance audit. So Oculus Health is who we represent. They have a complete turnkey solution. They identify out of your EMR which patients are eligible based on ICD-10 codes and their history. They will contact your patients at home. Their system is so sophisticated that when they call the patient at their home, your name will display on the phone. They educate the patient on the program. They enroll them. They prepare their care plan based on Mayo's best practices, and then they begin overseeing their care plan. The system automatically tracks the time that they spend with the patient. Oculus is the only compliance company in the country today that has a written guarantee that you will pass a Medicare compliance audit. It's not if, it's just simply a matter of when. So compliance is king. The good news is Medicare wants to send you new revenue. However, they will audit it to make sure you're in complete compliance with all 45 regulations. And if you're not, they will claw it back with a penalty. So Oculus is the only company that has a written guarantee. And in my mind, that's absolutely essential. Your patients will talk to the same MA who is Medicare certified each week. There are 200 patients assigned to one MA. All the MAs speak English. They all go to the office. They do not work out of their home. They're all US based, which is important. Now, we also have multilingual to meet the needs of your patients, whether they speak Spanish, Russian, whatever. We do have MAs that can speak any language. But it's important to know that they work out of the office here in the United States. So, here's how the program works. At the end of the month, Oculus is going to send a super bill to you listing the 1,359 patients, I'm making that number up, who participated in the program last month. They send you that list. You turn around and bill Medicare. Medicare will pay on the CPT code. Most of the geographies in the country, most of the MACs pay in 9 days, some pay in 14. They pay very promptly. This is their CPT code. It's their program. They want every senior in the country to participate. And at the same time, Oculus sends you an invoice, which is due in 30 days. So you actually sit on Medicare's money for a while before you have to pay Oculus. The benefits to you: no upfront costs, no ongoing costs for this program. There's no change required in the workflow. There's no new system to learn. You'd simply give Oculus the permission to access your EMR. They contact the patients. They educate them. They enroll them. They manage the program. They do all the heavy lifting. They're simply a new revenue source for you. All you do is bill Medicare once a month. And again, like I mentioned earlier, one of the main advantages to this program is now that we have a human being talking to your patients at least once a week, they're satisfied. They stop calling your office with questions. Now, if a situation arises during that weekly phone call where there's any urgent issue at all regarding their chronic condition, they will send you an electronic notice, an instant message via your EMR system. So you will instantly know to contact your patient. And of course, they'll recommend that the patient contact your office also. So think about this. You have someone talking to your patients at home every week. And if there's any issue that arises, you're going to be notified. That's a fantastic service to you and to your patients. So the practice registration. We have a recorded demo of the system, so you can see it if you'd like to. And the sales rep will, of course, answer any and all questions that you have. Once you're ready to begin the program, there's 3 documents for you to complete. There's an account setup form, there's the actual agreement, and then, of course, there's the BAA, which gives Oculus the authority and permission to gain access to your EMR. And then Oculus takes it from there. To implement this, Oculus, again, handles the enrollment process and the education process. And they have a patient rewards program, which is wonderful. So, you know, if the patient takes their medications every day for a month and they get so many points, and they can get a rewards program. They go out to dinner, they can go to movie theater, they can whatever, you know, a typical rewards program. They're the only company in the country that has that too. So less than 1% of your patients will ever leave the program. So this is a wonderful program. We just wanted to give you a highlight of it. To give you an example, if you have 1,500 patients in your database, seniors in your database, you make about $17 a month profit per patient. Well, that's $25,000 a month that you don't have today for essentially really doing nothing other than billing Medicare. So we want to thank you for looking at this brief overview. Please ask your sales representative any questions. Again, we can show you a demo of the system, and we look forward to getting you started. Just to let you know one more thing. There's a bill in the Senate right now to waive any copays associated with Medicare Advantage programs out there, if any. Once that bill's passed, then our guess is the next step is Medicare is going to mandate that doctors participate in this program. That's why we want to let you know about this program now and to begin participating in the program today, because as soon as that's mandated, well, all of a sudden every doctor in the country is going to be interested. And again, only one doctor can be paid per patient. So the first doctor who enrolls the patient wins, and will have this new revenue source from Medicare. So we really appreciate your time, and please feel free to call us with any questions. Thank you so much.